Hey everyone, welcome to the Keep 'em Healthy podcast. This is your host, Jamie. We are locked in on season 4. This season is going to be full of curiosity, learning, and great conversation. If this show is helpful to you, please share these episodes and follow this podcast on your podcast apps. Thank you so much for listening. Let's get this conversation started. Today on the Keep 'em Healthy podcast, I have Stacey Roberts. Stacey Roberts is a physical therapist and holistic registered nurse, and she combines a bunch of different expertise to create a healthcare journey that is unique to you and will create a treatment plan according to your needs. And so the blend of expertise includes functional medicine, physical therapy, nursing, and complementary medicine to craft the strategies that are unique as you are. Stacey has also recently wrote a book. She is the author of the #1 best-selling book, The Pain-Free Formula: Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections. And she also hosts the #1 podcast on chronic pain, The Pain-Free Formula. So today on the podcast, we have the pleasure of talking to Stacey about joint pain specifically and how it relates to food sensitivities. And we're taking this scope of knowing that joint pain may not come from an actual specific injury. It might be a bigger story than that. And so Stacey's going to give us some insight of more questions and more ways to look at joint pain outside of the acute trauma version of the story. So without further ado, let's introduce Stacey Roberts and hear what she has to say about food sensitivities and joint pain. Stacey Roberts, welcome to the Keep 'em Healthy podcast.
Oh my gosh, thank you so much for having me.
It's a pleasure. I was looking at your website, the New You Health and Wellness company that you have, and I was reading how you are creating a whole person approach by using functional medicine, physical therapy, nursing, and complementary medicine. I just was like, whoa. There's so many things, which is so great because we know it's not one size fits all and that there's a lot of complexity in your health and wellness. Can you give us just an insight of how you got to this point of thinking that this is what people need in their lives?
Sure. How much time do we have? No, I'm just kidding. So I've been a physical therapist for 36 years. And at times, especially early on in my career, I would always wonder, well, these people are doing everything that I'm asking them to do, exercise, doing all the right manual therapy, yada, yada. And they still weren't getting better. And a lot of times you can use the excuse of, they're not doing the stuff at home that they should be doing. But some people actually were. So that was always in the back of my mind. And I happened to move to overseas to Australia, and I had some of my own health issues and kind of started really connecting the dots of my gut health, food sensitivities, how that was impacting my joint pain, my thyroid, my overall health. So I started taking a more holistic approach and became an herbalist for healthcare professionals, and then came back to the US, and I just was getting a little bit bogged down in the physical therapy world and going, okay, what else is out there? I want to expand my scope of practice now that I have all this information. And then I went to nursing school to become a nurse practitioner. So I have my master's in nursing, and I'm close to being a nurse practitioner. I just don't have time to do my clinicals, because then my clinic kind of blew up with, it really invigorated me to renew my passion in physical therapy by finding something like our soft wave therapy, which works with pain, localized pain, but then marrying that with the functional medicine side that I know and the natural support, complementary support. So that's really kind of the journey in a nutshell of how I got to where I am, and just realizing, like you just said, it's not a one size fits all approach, and people are looking for that personalized program that can address all the different areas. So I've got a foot in conventional, a foot in natural, and really try to look at the person to see what they individually need.
That's great. I think people will find comfort in that bridge between conventional and the functional. And then also what you said about food sensitivities and joint pain, that's really where I would love to head today, and just kind of give our listeners some insight of what you've learned and how you incorporate your practices to help people understand how joint pain can coincide with food sensitivities. So maybe we get started by what food sensitivities are and launch from there.
Sure. So I'll start with really what they're not. So a lot of people think it's an allergy. So if you think of it really truly an allergy. It's you eat strawberries and you break out in hives. You get stung by a bee and your throat swells up. Those are allergies. Those are anaphylactic reactions. Those are something called IgE reactions from the immune system. So these are food sensitivities. So that means that you might have some exposures to those foods and you don't react right away. But over time, if you have repeated exposures to that, then the inflammation can build up and you might have a reaction. A lot of people see it coming out on their skin. They might have eczema, psoriasis, things like that. It could be headaches, could be really anything. And I honestly didn't know that joint pain would be something that would kind of pop up with this until I had a patient who I was seeing her for, I believe it was hormone health and optimizing her fertility. And just it's something that she was saying in the initial evaluation. I'm like, have you ever been checked for celiac disease? And she hadn't. She went and got checked, and sure enough, she had celiac disease. So she eliminated all the gluten. And at that time, I wasn't seeing her for any joint pain. But one of the things that she said to me was, my joint pain like went away, my muscle and joint pain. That was kind of just this chronic, kind of under the radar, but just totally annoying, just went away once you got rid of gluten. So started thinking about myself, right? I'm like, that's really interesting. So I got rid of gluten and had some joint and muscle pain go away as well. So then another incident where I remember I was off gluten, off dairy, off sugar. I'm like, what else could be going wrong? My fingers, my hands started to hurt every morning when I would drive to work. And I was like, literally, what? This is crazy. I'm off all these things that are supposed to be the big, sensitivities, and I'm still having issues. So that's when I was eating really good, clean, and well. And I got x-rays. I didn't have any arthritis in my hands, even though I use them every day. So I thought, again, is it something that I'm eating? So I found a food sensitivity test probably about 18 years ago. I still use it today because it's well supported by the research. And I found out that it divides it into severe sensitivities, moderate, and minimal. So in when it came back, in the severe column was spinach. And guess what kind of smoothies I was having every morning? I was having spinach smoothies. So
Yep.
I eliminate the spinach and hand pain went away. So that taught me that it might even be foods that are good for us, right? That we're reacting to, and we wouldn't know it. Most of my patients say, I eat pretty well. I really don't think it's my food. But then when we get down to the nitty gritty and when we work on their localized issue, localized pain, and it's not going away by doing all the things where it should be, working on their biomechanics, how they move, utilizing our soft wave therapy, our manual therapy, all the things that should work. And when they're not, then we start to expand the scope. And one of the things is we look at food sensitivities and even things like blueberries or white potatoes or things that we would never think we're reacting to show up. And sometimes we have to eliminate them for a long period of time, sometimes only a couple months while we work on their gut health to restore their gut function to be as optimal as possible. And then their body can start to manage the little bit of inflammation that those foods can create. Hope that answered their question. That was a big, long-winded answer.
Well, it does. And the thing to keep in mind is that you made a mention of how, like, it could be blueberries, it could be spinach. And so for people who are saying the normal, I would say severe food sensitivities are gluten, dairy, and sugar, right?
Yep.
So those are the first three things everyone is told to eliminate. And so it can be really frustrating. I can imagine your frustration in that moment, Stacey, when you're like, okay, what else could I take out in order for this joint pain to go away? And so nobody would say it's your spinach smoothies. That's just not the conventional line of thinking. Now, at that point in time, now I'm curious, are you back on spinach from then, or did you cut that out? And okay, so how did you go from not being able to take that spinach to being able to now eat spinach?
Thanks for bringing that up, because I also wanted to talk about too, in the smoothies, I had like, I don't know, 10 or 12 ingredients. So I figured
Right.
it was the smoothie. If it was going to be food, I figured it was the smoothie because it was happening like within a couple hours of having it. But I was going to town on the spinach because I'm like, this is great for me. This is awesome. Da da da.
Yeah.
And then once I worked on my gut health and just overall improvement, and we all have to. It's not a like you work on your gut health one time and then it's magically fine. It's like being in a relationship, right? A marriage. It's constant work. You got to constantly keep up on it. And so over time, after I did that, I thought, you know what? I'm just going to try it. I'm going to try it again. Because one of the way that I look at it in my clinic is I don't want to take away all these foods. I want to either be able to add some of them back in or make sure that we get diversity from other types of foods. So a lot of people are thinking elimination diet. I'm not going to be able to eat anything. My goal is to get to them to eat things that they never thought of eating and enjoy those foods. and then gradually, if possible, add some of those foods back in. So that's what I did. I was about a year and I was like, you know what? I'm going to try spinach. And now I have spinach in my salad. I can mix it in, and I've been retested. Like I said, the first test was like 18 years ago ish. And now I tested, and it comes up as a non issue for spinach. So, and other things, gluten has always come up for me in those food sensitivities. And even having genetic testing done in the last 5 to 7 years, I do have a gene that makes me predisposed to either being celiac or having a gluten sensitivity. So I didn't know that at the time of getting rid of gluten, but it's definitely fit the puzzle for sure when I found that out.
Interesting. So gluten, what you would say would be one that you just can't bring back in. That's
Yeah.
one of the things that it's a hard
Yeah.
no.
I tried the last test that I had done, I think it was 2 years ago, and it said that I was only minimally uh,
Okay.
reacting to gluten. So I got a little cocky and I'm like, hey, it's only minimal. And on this test, if you have minimal, you can have it once in a while. And so I was like, that croissant looks pretty dang good. Had it, and yeah, no, it just I have digestive issues with it, and just feel tired, those types. So it's really not worth it to me now, especially these days when there's so many other good gluten-free options that are healthy. Back, when I first gave it up, it was really hard to find. But now it's relatively straightforward to find something gluten-free that's healthy and tastes good.
Absolutely. And I think that the restaurants and the cafes and everyone is a little bit more on point with providing options when you are gluten free for sure. So, my question is how frequently would you say you should test for food sensitivities? Is it by your symptoms, or is it just good to know every couple of years, or what is your take on that?
So personally, I check every 2 to 3 years. So,
Okay.
or if I'm having some symptoms where I'm like, okay, what's going on? It's not like I added anything, or, from a standpoint of medications or anything that could contribute. I didn't have an injury. I did mine recently 2 years ago when I had been in menopause for about 7 or 8 years, because I started getting some joint pain that I was like, interesting. I wonder if this has to do with hormones or does it have to do with my eating plan? And turned out to be a bit of a combination of both. So I would say every few years. I don't believe it needs to be done every year. I haven't done that for myself. So I start off with patients doing it once, and then sometimes they will want to do it within a year just to see if they're still reacting to foods. But most times you just get a really good handle on what you can and can't have. So I would either do it by, strange symptoms come up that, you hadn't really been experiencing before, that doesn't make sense, or like every few years do you have it done.
Okay. And then do you work with the patients with their microbiome, or is that something that you send out for?
So I do work with patients with their microbiome, and starting just really basic. I mean, we've got to start with what they're eating, right? To get
Mhm.
more whole foods, more diversity, supplementation to help improve these stuff called short chain fatty acids to create healthy mucus, which is food for the good bacteria in the gut. So all those things that we start in a very basic way. And then I used to do a lot of testing, like GI mapping and things like that. Recent research, and I'm not saying those are bad tests, but the recent research says that those are really just one stool sample.
Okay.
And you really need, the research is saying like 10 to 15 stool samples to get a really good idea of your full microbiome. So there's companies out there that do testing for sure. And I think that can give you some information, but really understanding that it's not the be all end all. And we do need to listen to our body in regards to symptoms, and you don't need to be on a zillion supplements in order to address it. So working with somebody who can help you, because they know you, they're looking at your hormones, they're looking at your gut, they're looking at your supplementation, they're looking at everything. That's really the best way of doing it. And I don't believe every person should have the same supplementation program, because we're all different, right? So and the microbiome is we're still in the early stages of it, even though it's testing and research has been going on for the last probably 10 years now. I mean, we're only skimming the surface. There's so much more to be learned about it.
Absolutely. And the more that comes out, the more exciting it is. But I also sometimes feel like the more that comes out, the more confused I am. But that's
Yep.
okay. But you talked about the short chain fatty acids about to help create mucus. In what ways, or what do you eat, or how do you help to facilitate your gut lining to create those?
So there's some really great herbs that can help with that. There's things like, there's a supplement called Composure by the AIM companies that has 5 or 6 different herbs that help to support that. Even things like butter you can have that has butyric acid in it, which helps with that short chain fatty acid. There's eating really whole foods, good, healthy fats, all those types of things are going to help with decreasing inflammation and allowing the body to bring that, to create more of those short chain fatty acids. So really getting a good diversity in your diet helps as well too. So there's so many different things that we can do to optimize that. Inulin is another supplement that you can use. It's a prebiotic fiber that also improves short chain fatty acids as well too. So many different things.
I've been hearing a lot about fiber now that you just mentioned fiber, and I feel like fiber is trying to have its moment because protein has had its moment so for the time being. And I think that a lot of practitioners are saying like protein's cool, don't get me wrong, but like let's lean in a little bit on this fiber situation. It's super important and we don't get enough. Are you seeing that with your patients as well?
Yep, and I love fiber from the fact it really can help me see if a patient is having issues with their gut that otherwise they wouldn't necessarily know, and they potentially blame it on the fiber. So, for example, if you're having a little bit of fiber in your diet from your vegetables and fruit, that's fantastic. But if you start to get the amount of grams, 20, 30, 40 grams a day, and you're starting to feel bloated and uncomfortable, a lot of people blame it on the fiber, right? That's like taking a really good probiotic and you feel bloated and uncomfortable, and they say, oh, probiotics aren't good for me. We have to flip the script on that because fiber is good for us and probiotics are good for us. So as long as we're taking a good quality brand that doesn't have a lot of other additives and things in it, our body should be able to tolerate that. But if our gut is out of whack, so if our bad bacteria is more than our good bacteria, for example, the bad bacteria uses that fiber just like the good bacteria, right? So if we get up to a point where we're eating the fiber and our gut is upset, it's a sign that we have an imbalance of that good versus bad bacteria. The same with probiotics. As long as they're good quality, we're just replacing what should already be in the gut. So if we start to have those types of reactions, I love utilizing fiber from the standpoint of, I don't want to call it diagnosing, but giving me an idea if the gut needs more work. And then if they do have those symptoms, then you just back off on the fiber and you gradually work by improving the gut, the balance of the good and bad bacteria, and then you gradually increase the fiber, and all of a sudden, there you go. You're able to tolerate the fiber, bowel movements are better, inflammation's down, and it's not a couple day thing. This can take a few months in order to kind of flip that switch.
Okay. So if you have those symptoms and you feel like, okay, the bad bacteria is inflaming me and I'm having bloating, how do you kill off the bad bacteria? Is that through the elimination diet with the like taking away sugars and the things that feed the bad bacteria? What is your approach of doing that?
Yep. So you look at your eating plan, right? So if you have those symptoms that we talked about, then we look at what can we replace. We might need to do food sensitivity testing, right, to
Okay.
see if we can decrease the inflammation. Some people not so much. Some people, if I just add a probiotic, then their gut health starts to improve, all that type of stuff. Other people are more complicated, right? So what we'll do is as much of a whole food diet as possible is really important. Staying away from your ultra processed foods and even relatively minimally processed foods to kind of reset the health of the gut, and then adding in a good probiotic supplement that they can tolerate. Then slowly, and a lot of this stuff has to be done slowly because if somebody has SIBO or small intestine bacterial overgrowth, they can be aggravated very easily. So a lot of this has to be done slowly. So a combination of looking at food sensitivity if necessary, changing the diet for sure. If it's not more whole foods based, definitely getting in there, getting on a probiotic at whatever dose they can tolerate. And some of the good, there's Akkermansia put out by Pendulum that is a very good quality probiotic. So even starting with like one or two of those strains and then branching out into more of a multi-strain is another way that we kind of reset that good bacteria. So we're never going to get rid of the bad. And I say bad because it's considered bad in relation to the good bacteria, but we don't even know. Some of the bad bacteria may have some good qualities as well too. But we just want a good balance so that we don't have those symptoms and we're optimizing our gut health.
It's interesting that you say that the bad and the good there is coined off of the relationship between the two, right? Whenever people have results back from their lab work and whatnot, and I always say to them, don't panic at the numbers that you see because a lot of the numbers are in relationship with another number. And so even if it may look bad, like, or that number is high or low, it might be good that it's high because something else is low. So I always say that because, so this is just another example. This is another perfect example. It's like it's okay to have bad bacteria, but it's not okay when the bad bacteria is taken over and there's no good bacteria. And like you said, we're learning so much more about the microbiome. So we don't even know what these quote unquote bad bacteria could be doing that as positive and as well. But it's just an interesting topic in general because we started with the joint pain and now we've just like totally segued into the stomach and the microbiome. But what people need to know is that it's so interconnected.
Absolutely.
And when you have inflammation and you have your stomach and your lining of your stomach is not doing its job, it will affect the rest of your body. So like you were saying, it could be headaches, it could be joint pain, it could be whatever else. So for the joint pain though, like we talked about how the microbiome and your gut is so important to have it being healthy. So when someone comes into you with joint pain, what advice would you give them?
So the first thing is we want to find the trigger, right? So we want to see what the trigger is. So if they are walking a certain way, and this has been proven in recent studies as well too, even by changing the way that their foot hits the ground, the way they push off when they're walking, it significantly decrease and even create positive changes in a knee that's full of arthritis, right? So how the person's moving, because if I have a scratch on my hand and it gets red and puffy, that's inflammation, right? If I leave it alone and take the trigger, the scratch, if I take that away, then the body's able to heal. So it goes from a pro-inflammatory phase into anti-inflammatory phase, and then the tissue can heal. But if I don't take that trigger away and it keeps on triggering it, right, it's just going to stay in that chronic pro-inflammatory phase. So if we can get the person moving differently so that they're not continually, let's say, scratching the scratch, then we're definitely on a way to decrease inflammation. And many of my patients, probably 70 to 80% of my patients that come in, especially who have arthritis or who have had a trauma or something where they've tweaked their knee, they've got a meniscus issue, just changing their biomechanics, utilizing what we call our soft wave therapy device, which decreases the inflammation locally in a faster way than I've ever seen before. So I would say to a patient who comes in to see me, we want to figure out if this is localized, which most of the time there is a component of localized inflammation, or is this systemic? Does it have to do with the gut joint axis? When I was researching my book, The Pain-Free Formula, I was like, well, how am I going to put this all together? Like, what evidence do I have that the gut really is has a relationship with our muscles and joints? And as I was doing my research, I found the gut joint axis, which was news to me. I was like, oh my gosh, this is perfect. This is exactly what I want. And it just proved that if somebody has leaky gut, like some people, as we talked about, might have skin issues, might have fatigue, but other people, if they've had previous injury to the joint, they have arthritis in their joint, some of the stuff that's leaching into the body could land in those joints and create more of an inflammatory effect. One of those products or one of those molecules is called lipopolysaccharides, for example. And they found that to be elevated in joints that have significant arthritis. So is it really wear and tear that creates arthritis, or is it this leaky gut? Those lipopolysaccharides end up migrating to that area that's already potentially inflamed, and then they're causing the wear and tear on the joint, not necessarily the person. So it's this whole different way and shift of thinking about muscle and joint health for sure.
Absolutely. And like you said, for most people, it makes sense if there's an injury or if there's a trauma, like why my knee is hurting or my ankle is hurting. But then if there isn't, and you're like, why do I have this chronic joint pain? Well, what's really going on? How are you eating? What's happening with your gut? And how is that all interacting in your body? And that is, it's an interesting story. Do you have any clients that had seen amazing success with changing their gut for their joint pain?
Oh yeah, absolutely. Especially those that are refractory. Excuse me, refractory meaning they're not responding well to the normal stuff that we typically do, like the biomechanics of soft wave therapy, the manual therapy, the advanced physical therapy. Then we start looking at their eating plan, and most of them are very skeptical, hugely skeptical, and are like, I don't think so. I don't think this has anything to do with it. But then when we, kind of get there and nothing else has worked, they've had their shots, they've been maybe even have had surgery, or they tell me, this has been a problem for 20 years, then I know, okay, there's probably something else going on here, right? Because our body should be able to heal itself within that period of time for sure. So we have had a couple of situations where a woman, probably the one that overall, like her body was a majorly different overhaul after we did food sensitivity testing and worked on her gut health. She not only decreased just general pain, her brain fog went away, her energy levels improved, her skin was brighter, her eyes were brighter, and she lost 40 pounds. I mean, she was like the perfect example of a person. And this was within 6-7 months time of it. She just needed to optimize, and she was trying her best. She was trying to eat the healthy foods that she thought she was supposed to eat, get rid of carbs, optimize protein. And she still had all these symptoms. And that was probably the one that really made me go, you know what? I need to get this out to more people, not just my patients that I see, but there's more people out there that could really benefit from it. And that's why I wrote the book, The Pain-Free Formula.
I love that. And in the pain-free formula, do you talk to anything about the low FODMAP diet? Is that something that you use or no?
I don't. And this is the reason why. It's not that I don't like it or that it's bad. I just have found that that is so restrictive, and you don't really have evidence of, do they really need to remove all those foods, right? So some of the foods that they remove might actually be helpful for them, right? Might actually be nutritious for them. They might not be reacting to those foods. So I don't go by strict FODMAP, but sometimes when we do the food sensitivity, we see that they end up being similar to a FODMAP diet. At least now we have the evidence to say that that would be the right eating plan for them. But the vast majority of the time, it's not as restrictive as a FODMAP diet, and patients will get better faster because they're not eliminating foods that they aren't reacting to as well.
That makes sense. You want to keep the foods that are going to be nutritious for them, but then also removing the ones that are not. But I can understand the resistance of people because it's a lot of hard work to prep and shop and buy all the certain things that you need, and to create meals for this type of lifestyle that and the culture that we live in is really hard. So I can understand why people are like, yeah, no, I'd rather not. I'd rather go all the other directions first
Mhm.
before having to change it. But the thing is that when you invest in it, then you are going to have more time in your life because you're not going to be ill and you're not going to have to go to the doctors. And so you have to remember that you're investing in the food so you can have more high quality of life and time to do things you want. So you're not going to the doctors or having to call out sick or say, I can't do that activity because of my joint pain or whatever the case may be. So I appreciate just this understanding that sometimes it is localized, but sometimes it does require you to look at your gut and change your diet. So, Stacey, thank you for that. And I would love for you to tell us what's happening with your book right now and New You Health and Wellness, and like where we can find you. What's going on?
Thanks so much for asking that. So the book is on Amazon, The Pain-Free Formula, Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections. I have a podcast of the same name called the Pain-Free Formula Podcast. So you can find me there talking about different things. I think last week I talked about how laughter actually can reduce your pain. And next week I'll be talking about how chocolate can be great for pain reduction.
Yep, I'll listen to that one. That one I do like to have. Like I like people telling me yes to that.
Exactly. And then New You Health and Wellness is the name of my clinic in Milwaukee, Wisconsin. So our website is newyouhealthandwellness.com, all spelled out. And you can reach us through that site as well too.
That's awesome. And listeners, I will have all of this information in the show notes as well. So if you're curious and you want to see what's going on with that, you can find them there. And Stacey, thank you for sharing your insight on joint pain and food sensitivities and the gut and the microbiome and all the other information. This was awesome. And we hope to hear from you again.
Thank you. And thanks for having me. And thank you for all you do to help people as well.